Welcome to our channel. In this video we are going to discuss about hormonal imbalances and their profound effects on the body. Hormones are the chemical messengers that regulate numerous bodily functions, and when they're out of balance, it can lead to a variety of medical conditions. Let's explore some common conditions caused by hormonal imbalances. 1. Type 1 diabetes. Type 1 diabetes, a chronic condition typically diagnosed in children and young adults, is caused by insufficient production of insulin. Insulin is a hormone produced by the pancreas that plays a crucial role in regulating blood sugar levels. In a healthy body, insulin allows glucose from the food we eat to enter cells, where it is used for energy. However, in individuals with type 1 diabetes, the body's immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. This autoimmune response leaves the body with little to no insulin, causing glucose to build up in the bloodstream instead of being used by the cells. Without sufficient insulin, the body's cells are deprived of the energy they need to function properly. This lack of energy can lead to symptoms such as fatigue, excessive thirst, frequent urination, unexplained weight loss, and blurred vision. These symptoms often develop rapidly and can become severe if not treated promptly. High blood sugar levels can also cause long-term complications, including damage to the eyes, kidneys, nerves, and cardiovascular system. The exact cause of type 1 diabetes is not fully understood, but it is believed to involve a combination of genetic and environmental factors. Certain genes may make individuals more susceptible to the disease, and an environmental trigger, such as a viral infection, might initiate the autoimmune response. Unlike type 2 diabetes, which is often associated with lifestyle factors such as obesity and lack of exercise, type 1 diabetes is not preventable and is not related to lifestyle choices. Managing type 1 diabetes requires a lifelong commitment to monitoring blood sugar levels and administering insulin. Individuals with this condition need to regularly check their blood glucose levels using a glucometer and adjust their insulin doses accordingly. Insulin can be administered through injections or an insulin pump, which provides a continuous supply of insulin throughout the day. In addition to insulin therapy, maintaining a balanced diet, engaging in regular physical activity, and monitoring carbohydrate intake are essential for managing blood sugar levels and overall health. Living with type 1 diabetes also involves being prepared for emergencies, such as hypoglycemia, which can occur if too much insulin is taken or if a meal is missed. Symptoms of hypoglycemia include shakiness, sweating, confusion, and irritability. If left untreated, it can lead to loss of consciousness or seizures. People with type 1 diabetes need to carry a source of fast-acting sugar, such as glucose tablets or juice, to quickly raise their blood sugar levels in case of an emergency. Despite the challenges, many individuals with type 1 diabetes lead full and active lives. Advances in medical technology, such as continuous glucose monitors and artificial pancreas systems, are making it easier to manage the condition and improve quality of life. Ongoing research is also focused on finding a cure for type 1 diabetes, with promising developments in areas such as beta cell transplantation and immunotherapy. While there is no cure for type 1 diabetes yet, scientists are exploring several potential treatments. One promising area of research is beta cell transplantation, which involves replacing the destroyed beta cells with healthy ones from a donor. Another area of interest is immunotherapy, which aims to modulate the immune system to prevent it from attacking the beta cells. These advancements offer hope for the future and may one day lead to a cure for type 1 diabetes. In the meantime, education and support are crucial for those living with type 1 diabetes. Understanding the condition and its management can help individuals make informed decisions about their health and lifestyle. Support from family, friends, and healthcare professionals can also play a significant role in managing the emotional and physical challenges associated with the condition. 2. Type 2 diabetes. Type 2 diabetes is a chronic condition that develops primarily due to insulin resistance, a state in which the body's cells become less responsive to the hormone insulin. Unlike type 1 diabetes, where the body's immune system destroys insulin-producing cells, type 2 diabetes typically occurs later in life and is more closely associated with lifestyle factors such as poor diet, lack of physical activity, and obesity. In a healthy individual, insulin facilitates the entry of glucose from the bloodstream into the cells, where it is utilized for energy. However, in type 2 diabetes, the cells fail to respond effectively to insulin. As a result, the pancreas compensates by producing more insulin to help glucose enter the cells. Over time, this increased demand strains the pancreas, and it may become unable to produce sufficient insulin. Consequently, glucose accumulates in the bloodstream, leading to high blood sugar levels. The onset of type 2 diabetes is usually gradual, and its symptoms can be subtle or even absent in the early stages. Common symptoms include frequent urination, excessive thirst, fatigue, blurred vision, and slow-healing wounds. If left unmanaged, the condition can lead to serious health complications such as heart disease, kidney failure, nerve damage, and vision problems. The exact cause of type 2 diabetes involves a complex interplay of genetic and environmental factors. A family history of diabetes increases the risk, but lifestyle choices play a significant role in its development. A diet high in refined sugars and unhealthy fats, combined with sedentary behavior, contributes to obesity, a major risk factor for insulin resistance and type 2 diabetes. Age and ethnicity also influence susceptibility, with older adults in certain ethnic groups, such as African Americans, Hispanics, and Native Americans, being at higher risk. Managing type 2 diabetes primarily revolves around lifestyle modifications. Diet and exercise are cornerstone interventions. Adopting a balanced diet rich in whole grains, lean proteins, vegetables, and healthy fats helps regulate blood sugar levels. Regular physical activity improves insulin sensitivity, allowing the body to use glucose more efficiently. Weight loss, even a modest amount, can significantly improve blood sugar control and reduce the risk of complications. Regular monitoring of blood glucose levels is essential for individuals with type 2 diabetes to manage their condition effectively. Routine checkups with healthcare providers help track the disease's progression and adjust management plans as needed. Managing stress and getting adequate sleep are also important, as they can influence blood sugar levels. Living with type 2 diabetes requires a proactive approach to health. While the condition can be challenging, many people successfully manage their diabetes through education, support, and consistent adherence to management plans. Advances in medical research and technology continue to improve the lives of those with type 2 diabetes, offering new ways to monitor and control blood sugar levels more effectively. Education is a critical component in managing type 2 diabetes. Understanding the condition, its causes, and its effects on the body empowers individuals to make informed decisions about their health. Educational programs and resources provide valuable information on nutrition, exercise, and lifestyle changes that can help manage blood sugar levels. Support from family, friends, and healthcare professionals also plays a significant role in managing type 2 diabetes. A strong support network can provide encouragement, practical assistance, and emotional support, making it easier to adhere to lifestyle changes and management plans. Peer support groups, both in person and online, offer opportunities to share experiences, challenges, and successes with others who understand the condition. 3. Hypothyroidism. Hypothyroidism, often referred to as an underactive thyroid, is a condition characterized by insufficient production of thyroid hormones by the thyroid gland. This small butterfly-shaped gland located in the front of the neck plays a crucial role in regulating various bodily functions through the hormones it produces, primarily thyroxine, T4, and triiodothyronine, T3. These hormones influence metabolism, energy production, growth, and development throughout the body. The most common cause of hypothyroidism is Hashimoto's thyroiditis, an autoimmune disorder where the body's immune system mistakenly attacks the thyroid tissue. This attack leads to inflammation and damage to the thyroid gland, impairing its ability to produce enough hormones. Over time, the thyroid gland may become progressively damaged, further reducing hormone production. Other causes of hypothyroidism include surgical removal of the thyroid gland, radiation therapy to the neck area, certain medications, and iodine deficiency, although this is rare in regions where iodine is routinely added to salt. The symptoms of hypothyroidism can vary widely among individuals and may develop gradually, making them easy to overlook or attribute to other factors. Common symptoms include fatigue and weakness, weight gain or difficulty losing weight, cold intolerance, dry skin, hair loss, muscle aches and stiffness, constipation, and depression. Some people may also experience cognitive difficulties, such as memory problems and difficulty concentrating. Women with hypothyroidism often notice changes in their menstrual cycles, including heavier or irregular periods, and may have difficulty becoming pregnant. Diagnosing hypothyroidism typically involves a combination of clinical evaluation and laboratory tests. The primary blood test used to diagnose and monitor thyroid function is measuring thyroid-stimulating hormone levels. Elevated thyroid-stimulating hormone levels indicate that the pituitary gland is signaling the thyroid to produce more hormones because the levels of T4 and T3 are too low. Additional tests may be performed to measure levels of T4 and T3 directly, providing a more comprehensive assessment of thyroid function. Managing hypothyroidism effectively requires ongoing monitoring and lifestyle adjustments. Periodic blood tests are necessary to assess thyroid hormone levels and ensure that the body's requirements for hormones are being met. Factors such as age, weight, other medications being taken, and changes in health status can affect hormone requirements, necessitating adjustments in management. In addition to monitoring, lifestyle modifications can play a supportive role in managing hypothyroidism. Eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins can provide essential nutrients and support overall health. Foods that are rich in iodine, selenium, and zinc are particularly beneficial, as these nutrients are crucial for thyroid function. However, it is important to avoid excessive consumption of goitrogenic foods, such as cruciferous vegetables like broccoli and cabbage, and soy products, as these can interfere with thyroid function in some individuals. Regular exercise can help improve metabolism and alleviate symptoms such as fatigue and weight gain. Physical activity can also enhance mood and cognitive function, counteracting the depressive symptoms and cognitive difficulties often associated with hypothyroidism. Stress management techniques such as mindfulness, meditation, and yoga can also be beneficial, as chronic stress can negatively impact thyroid function and overall well-being. Living with hypothyroidism requires ongoing awareness and collaboration with healthcare providers to ensure optimal management of the condition. Education about hypothyroidism is crucial, as understanding the condition helps individuals recognize symptoms, adhere to management plans, and make informed decisions about their health. Support from family, friends, and healthcare professionals can also play a significant role in managing the emotional and physical challenges associated with the condition. By staying informed and proactive, people with hypothyroidism can maintain their health and well-being. For hyperthyroidism, hyperthyroidism, often referred to as an overactive thyroid, is a condition characterized by excessive production of thyroid hormones by the thyroid gland. This small butterfly-shaped gland located in the front of the neck plays a crucial role in regulating various bodily functions through the hormones it produces, primarily thyroxine, T4, and triiodothyronine, T3. These hormones influence metabolism, energy production, growth, and development throughout the body. The most common cause of hyperthyroidism is Graves' disease, an autoimmune disorder where the immune system mistakenly attacks the thyroid gland, causing it to produce too much thyroid hormone. Graves' disease can lead to the enlargement of the thyroid gland and may also affect other parts of the body, such as the eyes. Other causes of hyperthyroidism include thyroid nodules, inflammation of the thyroid gland, excessive iodine intake, and, rarely, certain medications. The symptoms of hyperthyroidism can vary widely among individuals and may develop gradually or suddenly. Common symptoms include weight loss despite increased appetite, rapid heartbeat and palpitations, heat intolerance and excessive sweating, nervousness, anxiety, irritability, tremors, difficulty sleeping, frequent bowel movements or diarrhea, muscle weakness or fatigue, and menstrual irregularities in women. Some individuals with hyperthyroidism may also experience bulging of the eyes, which can occur in Graves' disease due to inflammation and swelling of the tissues behind the eyes. This can lead to eye discomfort, dryness, double vision, and in severe cases, vision loss. Diagnosing hyperthyroidism typically involves a combination of clinical evaluation, physical examination, and laboratory tests. The primary blood test used to diagnose and monitor thyroid function is measuring thyroid-stimulating hormone levels. In hyperthyroidism, TSH levels are typically low because the pituitary gland reduces its production of TSH when thyroid hormone levels are elevated. Additional tests may be performed to measure levels of T4 and T3 directly, providing a more comprehensive assessment of thyroid function. Managing hyperthyroidism effectively requires ongoing monitoring and adjustments in lifestyle to achieve and maintain thyroid hormone levels within the normal range. Regular follow-up visits with healthcare providers are essential to monitor thyroid function, assess symptoms, and ensure overall health. In addition to monitoring, lifestyle modifications can help support overall health and well-being for individuals with hyperthyroidism. Eating a balanced diet that includes adequate nutrients, particularly iodine and selenium, is essential for thyroid health. However, excessive iodine intake should be avoided, as it can exacerbate hyperthyroidism. Consuming foods rich in antioxidants, such as fruits and vegetables, can help reduce inflammation and support immune function. Regular exercise can help manage symptoms such as fatigue, muscle weakness, and weight loss. Physical activity can also improve cardiovascular health, which is important given the potential for heart-related complications in hyperthyroidism. Activities such as walking, swimming, and yoga can be particularly beneficial, as they provide both physical and mental health benefits without putting excessive strain on the body. Stress management techniques, such as mindfulness, meditation, and deep breathing exercises, can help alleviate symptoms of anxiety, nervousness, and irritability associated with hyperthyroidism. Reducing stress can also improve sleep quality, which is often disrupted in individuals with this condition. Avoiding excessive caffeine and other stimulants is crucial for individuals with hyperthyroidism, as these substances can exacerbate symptoms such as rapid heartbeat, palpitations, and anxiety. Opting for caffeine-free alternatives and maintaining hydration with water and herbal teas can help manage these symptoms. Living with hyperthyroidism requires awareness of symptoms, adherence to management plans, and collaboration with healthcare providers to achieve optimal outcomes. Education about hyperthyroidism is critical, as understanding the condition helps individuals recognize symptoms, adhere to management plans, and make informed decisions about their health. Support from family, friends, and healthcare professionals can also play a significant role in managing the emotional and physical challenges associated with the condition. While hyperthyroidism presents significant challenges, advances in medical research and ongoing studies offer hope for better management and potential improvements in quality of life. With proper education, support, and lifestyle adjustments, individuals with hyperthyroidism can lead healthy and fulfilling lives. 5. Graves' disease. Graves' disease is a complex autoimmune condition that results in the thyroid gland becoming overactive, leading to a state known as hyperthyroidism. Unlike other forms of hyperthyroidism, Graves' disease is characterized by the production of specific antibodies, thyroid-stimulating immunoglobulins or thyroid-stimulating hormone receptor antibodies. These antibodies mimic the action of thyroid-stimulating hormone, causing the thyroid gland to produce excessive amounts of thyroid hormones, primarily thyroxine, T4, and triiodothyronine, T3. The onset of Graves' disease is often linked to a combination of genetic predisposition and environmental triggers, such as infections or stress. Women are more frequently affected, with the condition typically manifesting between the ages of 30 and 50. One of the distinctive features of Graves' disease is its potential to affect not only the thyroid gland but also other parts of the body, notably the eyes and skin. Symptoms of Graves' disease can vary widely and are a result of the heightened metabolic rate caused by excess thyroid hormones. Common symptoms include rapid heartbeat, palpitations, weight loss despite increased appetite, heat intolerance, excessive sweating, nervousness, tremors, difficulty sleeping, frequent bowel movements or diarrhea, muscle weakness, and fatigue. Many individuals also develop a goiter, a visible enlargement of the thyroid gland, and may experience eye-related symptoms such as bulging eyes, double vision, or eye irritation. Diagnosing Graves' disease involves a combination of clinical evaluation, physical examination, and laboratory tests. Blood tests are crucial to measure levels of thyroid hormones and thyroid-stimulating hormone, TSH. In Graves' disease, TSH levels are typically low due to the negative feedback from the elevated thyroid hormone levels. Additional tests, such as thyroid ultrasound or radioactive iodine uptake scan, may be used to assess the size and function of the thyroid gland. These diagnostic tools help to confirm the presence of Graves' disease and distinguish it from other thyroid conditions. Managing Graves' disease requires a comprehensive approach that includes regular monitoring and lifestyle modifications to achieve and maintain normal thyroid hormone levels. Regular follow-up visits with healthcare providers are essential to monitor thyroid function, assess symptoms, and make necessary adjustments in management strategies. In addition to medical management, lifestyle modifications play a crucial role in supporting overall health and well-being for individuals with Graves' disease. A balanced diet that includes adequate nutrients, particularly iodine and selenium, is essential for thyroid health. However, excessive iodine intake should be avoided, as it can exacerbate hyperthyroidism. Consuming foods rich in antioxidants, such as fruits and vegetables, can help reduce inflammation and support immune function. Regular exercise can help manage symptoms such as fatigue, muscle weakness, and weight loss. Physical activity can also improve cardiovascular health, which is important given the potential for heart-related complications in hyperthyroidism. Activities such as walking, swimming, and yoga can be particularly beneficial, as they provide both physical and mental health benefits without putting excessive strain on the body. Stress management techniques such as mindfulness, meditation, and deep breathing exercises can help alleviate symptoms of anxiety, nervousness, and irritability associated with Graves' disease. Reducing stress can also improve sleep quality, which is often disrupted in individuals with this condition. Avoiding excessive caffeine and other stimulants is crucial, as these substances can exacerbate symptoms such as rapid heartbeat, palpitations, and anxiety. Opting for caffeine-free alternatives and maintaining hydration with water and herbal teas can help manage these symptoms. Living with Graves' disease requires awareness of symptoms, adherence to management plans, and collaboration with healthcare providers to achieve optimal outcomes. Education about Graves' disease is critical, as understanding the condition helps individuals recognize symptoms, adhere to management plans, and make informed decisions about their health. Support from family, friends, and healthcare professionals can also play a significant role in managing the emotional and physical challenges associated with the condition. Public awareness and advocacy are important in supporting those with Graves' disease. Increased awareness can lead to better understanding, reduced stigma, and improved access to resources and support. Advocacy efforts can also drive funding for research and advancements in management options. While Graves' disease presents significant challenges, advances in medical research and ongoing studies offer hope for better management and potential improvements in quality of life. With proper education, support, and lifestyle adjustments, individuals with Graves' disease can lead healthy and fulfilling lives. Managing the condition effectively requires a comprehensive approach that includes regular monitoring, lifestyle modifications, and a strong support network. By staying informed and proactive, people with Graves' disease can maintain their health and well-being. 6. PCOS, polycystic ovary syndrome, POS, is a common hormonal disorder that affects people with ovaries, often causing a range of symptoms due to an imbalance in reproductive hormones. Typically, POS manifests during a person's reproductive years and can have significant implications for fertility and overall health. One of the key features of POS is irregular menstrual cycles. This irregularity can manifest as infrequent periods, prolonged periods, or periods that occur unpredictably. The hormonal imbalance associated with POS disrupts the normal process of ovulation, the release of eggs from the ovaries, which is essential for regular menstrual cycles. As a result, some individuals with POS may experience difficulty getting pregnant due to irregular ovulation or lack of ovulation altogether. In addition to menstrual irregularities, POS is characterized by elevated levels of androgens, often referred to as male hormones, such as testosterone. These elevated androgen levels can lead to symptoms such as excess facial or body hair, particularly on the face, chest, back, and abdomen. Acne and oily skin are also common due to increased sebum production associated with higher androgen levels. Another hallmark of POS is the presence of multiple small cysts on the ovaries. These cysts are not harmful but contribute to the condition's name, although not all individuals with POS have ovarian cysts. These cysts are actually follicles that have not developed properly due to hormonal imbalances, and they can be seen on ultrasound examinations of the ovaries. The exact cause of POS is not fully understood, but genetics and hormonal factors play significant roles. It tends to run in families, suggesting a genetic predisposition. Insulin resistance, a condition where cells in the body become less responsive to the hormone insulin, is also frequently associated with POS. Insulin resistance can lead to higher levels of insulin in the bloodstream, which in turn can stimulate the ovaries to produce more androgens, exacerbating the hormonal imbalance. Diagnosing POS involves a combination of medical history, physical examination, and laboratory tests. Common diagnostic criteria include irregular menstrual cycles, elevated levels of androgens, and the presence of ovarian cysts on ultrasound. Other conditions, such as thyroid disorders and certain adrenal gland disorders, may need to be ruled out because they can mimic symptoms of POS. Managing POS typically focuses on addressing symptoms and reducing the risk of long-term complications. Lifestyle modifications, such as adopting a healthy diet, regular exercise, and weight management, can help improve insulin sensitivity and regulate hormone levels. This is particularly important for individuals with insulin resistance. Additionally, managing stress and getting adequate sleep are crucial, as stress and sleep deprivation can exacerbate hormonal imbalances and worsen symptoms. Living with POS involves ongoing management and monitoring of symptoms, as well as regular follow-up with healthcare providers. Education about the condition, its potential complications, and management strategies is essential for empowering individuals with POS to make informed decisions about their health. With proper management, most people with POS can lead healthy lives, and with appropriate fertility treatments if needed, achieve successful pregnancies. In addition to the physical aspects of POS, the condition can also have significant emotional and psychological impacts. Many individuals with POS experience anxiety, depression, and body image issues due to the symptoms and challenges associated with the condition. Support from healthcare providers, mental health professionals, and support groups can be invaluable in managing the emotional and psychological aspects of POS. While POS presents significant challenges, advances in medical research and ongoing studies offer hope for better management and potential improvements in quality of life. By staying informed and proactive, individuals with POS can effectively manage their symptoms and lead fulfilling lives. 7. Adrenal disorders. Adrenal disorders encompass a diverse array of conditions that affect the adrenal glands, which are critical for producing hormones essential to various bodily functions. Among these disorders, Cushing's syndrome and Addison's disease stand out due to their distinct hormonal imbalances and the significant impact they have on individuals' health and well-being. Cushing's syndrome arises from prolonged exposure to excessive levels of cortisol, a hormone crucial for regulating metabolism, immune response, and stress management. This condition can develop from both external and internal factors. The symptoms of Cushing's syndrome reflect the broad-ranging effects of excess cortisol. These include weight gain, especially in the abdominal area and face, resulting in a rounded moon face appearance and fat deposits on the back of the neck. Muscle weakness, particularly in the limbs and trunk, skin changes such as thinning and easy bruising, high blood pressure, glucose intolerance leading to diabetes in some cases, and emotional disturbances like irritability and depression are also common. Additionally, individuals may experience irregular menstrual cycles in women and decreased libido in both men and women. Diagnosis involves a thorough evaluation of cortisol levels through blood, urine, or saliva tests, combined with imaging studies like MRI or CT scans to identify any tumors or abnormalities in the adrenal or pituitary glands. In contrast, Addison's disease or adrenal insufficiency results from inadequate production of cortisol and often aldosterone, a hormone crucial for maintaining sodium and potassium balance. The primary cause of Addison's disease is autoimmune destruction of the adrenal glands, where the body's immune system mistakenly attacks and damages these essential hormone-producing organs. Other potential causes include infections like tuberculosis, certain medications such as antifungal treatments, or genetic factors predisposing individuals to adrenal gland dysfunction. The hallmark symptoms of Addison's disease stem from deficiencies in cortisol and aldosterone. These include chronic and debilitating fatigue that worsens over time, unintentional weight loss despite increased appetite, low blood pressure leading to dizziness upon standing, orthostatic hypotension, hyperpigmentation characterized by darkening of the skin, especially in sun-exposed areas and skin creases, and cravings for salty foods due to sodium loss. Additionally, gastrointestinal symptoms such as nausea, vomiting, and abdominal pain may occur. Diagnosis involves blood tests to measure hormone levels, often including stimulation tests to assess adrenal function accurately. Living with Cushing's syndrome or Addison's disease requires ongoing medical supervision, adherence to prescribed medications, and vigilant management of symptoms and potential complications. For individuals with Cushing's syndrome, lifestyle adjustments such as maintaining a balanced diet, engaging in regular exercise, and employing stress management techniques are crucial for mitigating the adverse effects of elevated cortisol levels. Managing weight, monitoring blood pressure, and maintaining emotional well-being are also important aspects of living with this condition. For those with Addison's disease, lifestyle modifications play a similarly vital role. Ensuring adequate sodium intake, particularly in hot weather or during periods of intense physical activity, is essential to prevent hyponatremia and maintain electrolyte balance. Regular monitoring of blood pressure and staying hydrated are also important to manage the effects of aldosterone deficiency. Stress management and avoiding situations that could trigger an adrenal crisis are crucial for individuals with Addison's disease. Education and support are key components of managing adrenal disorders. Understanding the nature of these conditions, recognizing early symptoms of hormonal imbalances or adrenal crisis, and knowing how to respond to potential emergencies are essential for both patients and their caregivers. Support groups and counseling can provide emotional support and practical advice, helping individuals navigate the challenges associated with these chronic conditions. 8. Growth disorder. Growth disorders encompass a range of conditions that affect the normal growth and development of the human body. These disorders are often influenced by hormonal imbalances, particularly involving growth hormone, which plays a crucial role in regulating the growth of bones and tissues. Acromegaly is a disorder that typically affects adults. It occurs when the pituitary gland, located at the base of the brain, produces excessive amounts of GH. This overproduction is commonly caused by a benign tumor in the pituitary gland, known as a pituitary adenoma. As a result, individuals with acromegaly experience gradual enlargement of certain body parts, such as the hands, feet, and facial features. This condition develops slowly over many years, and symptoms may include joint pain, thickened skin, enlarged organs like the heart, and changes in facial appearance such as a protruding jaw and brow. The diagnosis of acromegaly often involves blood tests to measure GH levels and imaging studies to identify tumors in the pituitary gland. Gigantism, in contrast to acromegaly, occurs when excessive GH production begins before the closure of the growth plates during puberty. This early onset of GH excess leads to accelerated growth in height and overall body size. Children and adolescents with gigantism often grow much taller than their peers, sometimes reaching heights well above 7 feet. This rapid growth can cause various health complications, including joint problems, increased risk of heart disease, and vision impairments due to pressure on the optic nerve. Diagnosis of gigantism involves similar methods to those of acromegaly, with blood tests and imaging studies being crucial for identifying the condition. Dwarfism refers to a group of conditions characterized by shorter than average stature. It can result from a variety of genetic or medical conditions that impair bone growth and development. The most common form of dwarfism, known as achondroplasia, is caused by a genetic mutation that affects the conversion of cartilage to bone during development. Individuals with achondroplasia typically have normal intelligence and lifespan, but exhibit disproportionate limb and trunk lengths compared to their overall height. Other types of dwarfism may involve deficiencies in GH production or response, which can lead to shorter stature and delayed puberty. Diagnosing dwarfism often involves assessing growth patterns, conducting genetic testing, and evaluating bone age through X-rays to determine the extent of bone development. The impact of growth disorders extends beyond physical symptoms, affecting various aspects of an individual's life. For instance, individuals with acromegaly may experience significant changes in their appearance, leading to emotional and psychological challenges. The gradual nature of the condition means that changes may go unnoticed for years, delaying diagnosis and intervention. Similarly, those with gigantism may face social and emotional difficulties due to their unusual height and rapid growth during childhood and adolescence. They may also encounter practical challenges, such as finding appropriately sized clothing and furniture. Dwarfism, while often associated with normal intelligence and lifespan, presents its own set of challenges. Individuals with dwarfism may require modifications to their living environment to accommodate their shorter stature. They might also face social stigma and misconceptions about their condition, impacting their self-esteem and mental health. Despite these challenges, many individuals with dwarfism lead fulfilling lives, achieving success in various fields and advocating for greater awareness and acceptance of their condition. Understanding and managing growth disorders require a multidisciplinary approach involving endocrinologists, geneticists, orthopedic specialists, and mental health professionals. Early diagnosis and intervention are crucial for optimizing outcomes and improving the quality of life for affected individuals. Education and support for patients and their families are also essential in navigating the physical, emotional, and social aspects of living with a growth disorder. Growth disorders such as acromegaly, gigantism, and dwarfism highlight the critical role of growth hormone and genetic factors in human development. While these conditions vary in their causes and effects, they all require comprehensive medical care and support to manage symptoms, optimize growth, and enhance the well-being of affected individuals. Continued research and advances in medical science offer hope for better diagnostic methods, treatment options, and improved quality of life for those living with growth disorders. 9. Infertility. Infertility is a complex medical condition affecting millions of couples worldwide, impairing their ability to conceive despite regular, unprotected sexual intercourse. It can arise from various factors, with hormonal imbalances within the reproductive system being a significant contributor. These imbalances disrupt the delicate interplay of hormones essential for reproductive health in both women and men. Female infertility often stems from hormonal irregularities that affect ovulation, the release of mature eggs from the ovaries. Hormones such as follicle-stimulating hormone, FSH, and luteinizing hormone, LH, produced by the pituitary gland, are crucial for stimulating follicle development and triggering ovulation. Conditions like polycystic ovary syndrome, POS, illustrate how hormonal imbalances can interfere with these processes. In POS, elevated levels of androgens and insulin resistance disrupt normal ovarian function, leading to irregular menstrual cycles and ovulation problems. Similarly, inadequate production of progesterone after ovulation can impair the uterus's ability to prepare for implantation, further hindering fertility. Disorders affecting the hypothalamus-pituitary-ovarian axis, such as hypothalamic amenorrhea, can also disrupt hormonal signals necessary for ovulation and fertility. In male infertility, hormonal imbalances can affect testosterone production and sperm development. Testosterone, produced in the testes under the influence of luteinizing hormone, is crucial for sperm production. Low testosterone levels, often associated with conditions like hypogonadism, can impair spermatogenesis and reduce sperm quality and quantity. Elevated levels of other hormones, such as prolactin, can suppress testosterone production and interfere with sperm function. Conditions like varicocele, characterized by enlarged veins in the scrotum, can disrupt testicular blood flow and raise scrotal temperatures, further compromising sperm production and quality. Diagnosing infertility involves a thorough evaluation of hormone levels, reproductive health, and medical history for both partners. Hormonal tests, including blood tests to measure FSH, LH, estradiol, testosterone, and prolactin levels, help identify underlying hormonal imbalances contributing to infertility. Imaging studies such as pelvic ultrasound or testicular ultrasound may be used to assess reproductive organ structure and function. For some couples, genetic testing or specialized procedures like sperm analysis may provide additional insights into fertility challenges. Addressing infertility caused by hormonal imbalances underscores the critical role of hormones in reproductive health. Hormonal balance is essential for the proper functioning of reproductive organs and the processes they regulate. In women, balanced hormone levels ensure regular menstrual cycles, ovulation, and the ability of the uterus to support a pregnancy. In men, Adequate testosterone levels are necessary for the production of healthy sperm capable of fertilizing an egg. The psychological impact of infertility should not be overlooked. Couples experiencing infertility often face significant emotional stress, which can strain relationships and affect mental health. The uncertainty and repeated disappointments can lead to feelings of frustration, sadness, and anxiety. It is important for couples to seek emotional support, whether through counseling, support groups, or other resources, to help them cope with the emotional challenges of infertility. Lifestyle factors also play a role in reproductive health and can influence hormone levels. Factors such as diet, exercise, stress, and exposure to environmental toxins can impact hormone production and function. Maintaining a healthy lifestyle can support overall reproductive health and improve the chances of conception. This includes eating a balanced diet, engaging in regular physical activity, managing stress, and avoiding substances that can negatively affect fertility, such as tobacco and excessive alcohol. Infertility caused by hormonal imbalances highlights the intricate connection between hormones and reproductive health. Through personalized medical care, early diagnosis, and comprehensive fertility management, many couples can achieve their goal of starting or expanding their family. 10. Menstrual disorder. Menstrual disorders encompass a range of conditions that affect the normal menstrual cycle, which is crucial for reproductive health in women. Two common menstrual disorders are amenorrhea and dysmenorrhea, each presenting unique challenges and impacting women's overall well-being. Amenorrhea, characterized by the absence of menstrual periods in women of reproductive age, can be classified into two main types: primary and secondary. Primary amenorrhea refers to the failure to start menstruating by the age of 16, despite normal growth and development. This condition can be caused by genetic factors, hormonal imbalances, such as deficiencies in estrogen or progesterone, anatomical abnormalities in the reproductive system, or chronic illnesses affecting hormonal regulation. For instance, Turner syndrome, a chromosomal disorder, can lead to primary amenorrhea due to underdeveloped ovaries. Hormonal imbalances might arise from issues in the hypothalamus or pituitary gland, which play pivotal roles in regulating the menstrual cycle. Additionally, congenital structural anomalies, such as imperfect hymen or Mayer-Rokitansky-Kusterhauser syndrome, can prevent the onset of menstruation despite normal secondary sexual characteristics. Secondary amenorrhea occurs when a woman who previously had regular menstrual cycles stops menstruating for 3 or more months. Common causes include pregnancy, breastfeeding, excessive exercise, stress, significant weight loss or gain, hormonal contraceptives, thyroid disorders, and polycystic ovary syndrome, PCOS. Intense physical activity and low body fat can disrupt the hypothalamic pituitary ovarian axis, leading to a halt in menstrual cycles. Stress can also significantly impact menstrual regularity by affecting the hormonal balance necessary for ovulation. PCOS, characterized by irregular periods, elevated androgen levels, and polycystic ovaries, is a prevalent cause of secondary amenorrhea. Diagnosis typically involves evaluating medical history, conducting physical exams, and performing hormone tests to identify underlying causes. Dysmenorrhea refers to painful menstrual periods, which can range from mild discomfort to severe cramping that interferes with daily activities. Primary dysmenorrhea is typically caused by excessive production of prostaglandins, hormone-like substances that stimulate uterine contractions to expel the uterine lining during menstruation. These contractions can cause intense pain and cramping. Factors such as age, smoking, and early onset of menstruation may increase the risk of primary dysmenorrhea. Teenagers and young women often experience primary dysmenorrhea, with symptoms generally improving with age or after childbirth. The pain usually begins just before or at the start of menstruation and lasts for 1 to 3 days. Secondary dysmenorrhea, however, is often associated with underlying gynecological conditions such as endometriosis, fibroids, pelvic inflammatory disease, PID, or adenomyosis. Endometriosis involves the growth of uterine tissue outside the uterus, leading to inflammation and scarring, which can cause severe menstrual pain. Fibroids are benign tumors in the uterus that can increase menstrual pain and bleeding. PID, an infection of the reproductive organs, can result in chronic pelvic pain and menstrual irregularities. Adenomyosis, where the inner lining of the uterus breaks through the muscle wall, can cause heavy, painful periods. Diagnosis involves assessing symptoms, conducting pelvic exams, and sometimes using imaging studies or laparoscopy to identify underlying causes. Menstrual disorders like amenorrhea and dysmenorrhea can significantly impact women's reproductive health and quality of life. Understanding the underlying causes and appropriate management strategies are crucial for addressing these conditions effectively. Amenorrhea can lead to complications such as infertility and osteoporosis due to prolonged low estrogen levels. Dysmenorrhea can result in absenteeism from work or school and limit daily activities, affecting overall productivity and quality of life. Women experiencing menstrual disorders should seek medical advice to identify and address the root causes. Lifestyle modifications such as maintaining a balanced diet, engaging in regular physical activity, managing stress, and avoiding smoking can help improve menstrual health. Education and awareness about menstrual disorders are essential for early diagnosis and effective management, empowering women to take charge of their reproductive health. With proper diagnosis and personalized management plans, women can manage symptoms, restore menstrual regularity, and improve overall well-being. 11. Menopause and perimenopause. Menopause and perimenopause are significant phases in a woman's life, marked by the end of menstrual cycles and a transition towards the cessation of reproductive abilities. These stages bring about various symptoms largely caused by fluctuations and eventual declines in estrogen and progesterone levels. Understanding these hormonal changes and their impacts on the body can provide valuable insight into what women experience during these periods. Perimenopause is the transitional phase leading up to menopause, often starting in a woman's 40s but sometimes as early as her mid-30s. This stage can last several years and is characterized by fluctuating hormone levels, particularly estrogen and progesterone. These fluctuations can cause irregular menstrual cycles, which may become longer, shorter, heavier, or lighter. Women might also experience periods of amenorrhea before they stop entirely. A hallmark symptom of perimenopause is hot flashes, sudden feelings of warmth that spread over the body, often accompanied by sweating and a flushed appearance. These can occur at any time of day or night, and when they happen during sleep, they are referred to as night sweats. These symptoms can disrupt sleep, leading to fatigue and irritability. Mood swings are another common symptom. The hormonal roller coaster can lead to feelings of anxiety, depression, and irritability. Many women report experiencing heightened emotional sensitivity and periods of inexplicable sadness or anxiety. Memory problems and difficulty concentrating, often referred to as brain fog, can also be distressing aspects of perimenopause. As estrogen levels decline, vaginal and urinary symptoms can also emerge. Vaginal dryness, itching, and discomfort during intercourse are common due to thinning of the vaginal walls and decreased lubrication, a condition known as vaginal atrophy. Urinary symptoms such as frequent urination, urgency, and an increased risk of urinary tract infections are also linked to reduced estrogen levels. Another significant change during perimenopause involves sleep disturbances. Beyond the impact of night sweats, women often report difficulty falling asleep, staying asleep, or experiencing restorative sleep. Insomnia can further exacerbate mood swings and cognitive issues, creating a challenging cycle of symptoms. Menopause is defined as the point when a woman has gone 12 consecutive months without a menstrual period. The average age for reaching menopause is 51, but it can occur earlier or later. By the time menopause is reached, the ovaries have significantly reduced their production of estrogen and progesterone, leading to the end of menstruation and fertility. The symptoms experienced during menopause are similar to those of perimenopause, but can be more intense or persistent. Hot flashes and night sweats continue to be common complaints, often lasting for several years post-menopause. The lack of estrogen can also lead to changes in skin elasticity and moisture, resulting in drier, more fragile skin. Bone density loss accelerates during menopause due to the drop in estrogen, which plays a crucial role in maintaining bone health. This increases the risk of osteoporosis and fractures. Women are advised to monitor their bone health closely during this stage. The decline in estrogen also affects cardiovascular health. Estrogen helps maintain healthy cholesterol levels and supports the lining of blood vessels. Its reduction can lead to an increased risk of heart disease, which becomes more pronounced after menopause. Weight gain, particularly around the abdomen, is another common issue. Changes in metabolism and body composition, influenced by hormonal shifts, contribute to this weight gain. This can also increase the risk of developing chronic conditions such as type 2 diabetes. Emotional and mental health continues to be a concern during menopause. Anxiety, depression, and mood swings can persist, and the added stress of dealing with physical changes can compound these issues. Support from healthcare providers, family, and friends is crucial during this time. Menopause and perimenopause are natural biological processes that bring significant hormonal changes, primarily involving estrogen and progesterone. These changes manifest in a variety of symptoms, including hot flashes, mood swings, vaginal dryness, sleep disturbances, and increased health risks such as osteoporosis and cardiovascular disease. Understanding these symptoms and their causes can help women navigate these transitions more effectively, ensuring better management of their health and well-being during these stages of life. 12. Androgen insensitivity syndrome. Androgen insensitivity syndrome is a genetic condition that affects sexual development in individuals with a male XY chromosome pattern. AIS occurs when the body cannot properly respond to androgens, which are male sex hormones such as testosterone. This inability to respond to androgens results in a range of developmental outcomes, often leading to individuals having physical traits that do not typically align with their genetic sex. AIS can be divided into two main categories: complete androgen insensitivity syndrome and partial androgen insensitivity syndrome. In CIS, the body's cells are entirely unresponsive to androgens, while in PIAS, there is a partial response to these hormones, leading to a spectrum of physical characteristics. Complete androgen insensitivity syndrome is characterized by the complete inability of the body's cells to respond to androgens. Individuals with CIS typically have a female appearance despite having an XY chromosome pattern. Externally, they develop female secondary sexual characteristics, such as breast development and a typical female distribution of body fat, during puberty. However, they do not menstruate and lack a uterus and ovaries, having instead undescended testes that are often located in the abdomen or inguinal region. These individuals usually have a shallow vaginal pouch but no cervix. Due to the lack of response to androgens, the external genitalia are female, and individuals are typically raised as girls and identify as female. Partial androgen insensitivity syndrome ***, on the other hand, results in a partial response to androgens, leading to a wider range of physical characteristics. The degree of androgen insensitivity varies, causing individuals to exhibit a mix of male and female traits. Those with PIAS may have ambiguous genitalia at birth, making it challenging to assign a specific gender. During puberty, they might develop some male secondary sexual characteristics, such as an enlarged clitoris or small penis, along with female characteristics like breast development. The variability in androgen sensitivity means that the physical presentation of PIAS can differ significantly among individuals. AIS is caused by mutations in the AR gene, which provides instructions for making androgen receptors. These receptors allow cells to respond to androgens. Mutations in the AR gene disrupt this process, preventing the body from recognizing and utilizing these hormones effectively. AIS is usually inherited in an X-linked recessive pattern, meaning that the mutated gene is located on the X chromosome. Since males have one X and one Y chromosome, a single altered copy of the gene in each cell is sufficient to cause the condition. Females with two X chromosomes are typically carriers if they inherit one mutated copy, and do not usually exhibit symptoms because their second X chromosome provides a functioning copy of the gene. Diagnosing AIS involves a combination of physical examination, hormone level testing, genetic testing, and imaging studies. Individuals with CIS often come to medical attention due to the absence of menstruation or the discovery of undescended testes. Those with PIAS might be identified due to ambiguous genitalia or atypical development during puberty. Hormone tests can reveal elevated levels of androgens in the blood, which do not correspond with the individual's physical appearance. Genetic testing can confirm mutations in the AR gene, solidifying the diagnosis. Living with AIS involves addressing the physical, psychological, and social aspects of the condition. From a physical perspective, monitoring and managing the health of undescended testes is crucial due to the increased risk of testicular cancer. Psychological support is essential for individuals and their families to navigate the challenges of a condition that affects gender identity and sexual development. Socially, education and awareness can help mitigate misunderstandings and stigma associated with AIS. Individuals with AIS often face unique challenges related to their gender identity and the societal expectations tied to their physical appearance. It is vital to provide comprehensive, compassionate care that respects their gender identity and supports their overall well-being. Support groups and counseling can offer valuable resources for individuals with AIS and their families, helping them to cope with the emotional and social implications of the condition. Certain hyperandrogenism. Hyperandrogenism is a medical condition characterized by the excessive production of androgens, which are male sex hormones like testosterone. This hormonal imbalance can lead to a variety of symptoms and health issues, particularly affecting women. Androgens play a crucial role in both male and female bodies, influencing the development of male characteristics and reproductive function. However, when produced in excess in women, androgens can cause significant physical and physiological changes. One of the most noticeable and distressing symptoms of hyperandrogenism in women is hirsutism, which is the excessive growth of coarse, dark hair in areas where men typically grow hair, such as the face, chest, and back. This abnormal hair growth can lead to significant psychological and emotional distress, impacting a woman's self-esteem and quality of life. Hirsutism is often a key indicator of underlying hormonal imbalances and prompts further medical evaluation to determine the cause of excessive androgen production. Another common symptom associated with hyperandrogenism is acne. Androgens stimulate the sebaceous glands in the skin, leading to increased production of sebum. This excess oil can clog pores, creating an environment conducive to the growth of bacteria and the formation of acne. Women with hyperandrogenism may experience severe, persistent acne that is resistant to standard treatments. The presence of acne, particularly in conjunction with other symptoms like hirsutism, often points to elevated androgen levels and necessitates hormonal assessment. Hyperandrogenism can also affect the menstrual cycle, leading to irregularities such as oligomenorrhea or amenorrhea. Androgens can disrupt the normal hormonal regulation of the menstrual cycle, interfering with ovulation and the balance of estrogen and progesterone. As a result, women with hyperandrogenism may experience difficulties with fertility, as regular ovulation is essential for conception. Polycystic ovary syndrome is one of the most common causes of hyperandrogenism in women. POS is a complex endocrine disorder characterized by multiple small cysts on the ovaries, irregular menstrual cycles, and elevated androgen levels. Women with POS often present with a combination of symptoms, including hirsutism, acne, and menstrual irregularities. The exact cause of POS is not fully understood, but it is believed to involve a combination of genetic, hormonal, and environmental factors. In addition to POS, other medical conditions can lead to hyperandrogenism. Congenital adrenal hyperplasia is a genetic disorder that affects the adrenal gland's ability to produce certain hormones, leading to excess androgen production. Tumors in the ovaries or adrenal glands, although rare, can also cause hyperandrogenism by secreting large amounts of androgens. Additionally, certain medications and anabolic steroids can induce hyperandrogenism as a side effect. Managing hyperandrogenism often requires a multidisciplinary approach, involving endocrinologists, dermatologists, gynecologists, and primary care physicians. Lifestyle modifications such as maintaining a healthy weight can help manage symptoms and improve overall health. Weight loss, in particular, has been shown to reduce androgen levels and improve symptoms in women with POS. Cosmetic treatments, such as laser hair removal or electrolysis, can address hirsutism and improve appearance and self-confidence. Hyperandrogenism can have significant psychological impacts, including anxiety, depression, and reduced quality of life. Women experiencing these symptoms may benefit from counseling or support groups to address the emotional and social challenges associated with the condition. Educating patients about hyperandrogenism, its causes, and its management options is essential for empowering them to make informed decisions about their health. Hyperandrogenism is a condition characterized by excessive androgen production, leading to symptoms such as hirsutism, acne, and menstrual irregularities. It can result from various underlying causes, including PCOS, congenital adrenal hyperplasia, tumors, and medication side effects. Accurate diagnosis and a comprehensive, multidisciplinary approach to management are crucial for addressing the physical and psychological impacts of hyperandrogenism, improving quality of life, and promoting overall health. 14. Pituitary tumors. Pituitary tumors are abnormal growths that develop in the pituitary gland, a small pea-sized gland located at the base of the brain. This gland plays a crucial role in regulating various hormones that control key functions of the body, including growth, metabolism, and reproductive processes. Pituitary tumors can significantly affect the production of multiple hormones, leading to a range of symptoms and health issues depending on the type and size of the tumor. The pituitary gland is often referred to as the master gland because it produces hormones that influence many other glands in the endocrine system, including the thyroid, adrenal glands, ovaries, and testes. It is divided into two main parts, the anterior pituitary and the posterior pituitary. Each part secretes different hormones such as growth hormone, adrenocorticotropic hormone, thyroid-stimulating hormone, prolactin, and antidiuretic hormone, among others. When a tumor develops in the pituitary gland, it can either increase the production of specific hormones or decrease their production, leading to various clinical syndromes. One common type of pituitary tumor is the prolactinoma, which is a benign tumor that produces excessive amounts of prolactin. Elevated prolactin levels can lead to symptoms such as galactorrhea, unexpected milk production, amenorrhea, absence of menstrual periods, and infertility in women, as well as decreased libido and erectile dysfunction in men. Prolactinomas are the most frequently occurring type of pituitary tumor and can usually be diagnosed through blood tests measuring prolactin levels and imaging studies like MRI. Another type of pituitary tumor is the somatotroph adenoma, which secretes excessive amounts of growth hormone. When this occurs in adults, it leads to a condition called acromegaly, characterized by the enlargement of hands, feet, and facial features, as well as joint pain and cardiovascular problems. In children and adolescents, excessive GH can cause gigantism, leading to abnormal increases in height and growth velocity. Symptoms of acromegaly and gigantism develop gradually, often over several years, making early diagnosis challenging but crucial for effective management. Corticotroph adenomas are pituitary tumors that produce excessive adrenocorticotropic hormone, leading to overproduction of cortisol by the adrenal glands. This condition, known as Cushing's disease, results in symptoms such as weight gain, particularly around the abdomen and face, muscle weakness, high blood pressure, high blood sugar, and skin changes like easy bruising and purple stretch marks. Cushing's disease can have severe health implications, including an increased risk of diabetes and cardiovascular diseases. Thyrotroph adenomas are less common pituitary tumors that produce excessive thyroid-stimulating hormone, leading to hyperthyroidism. Symptoms of hyperthyroidism include weight loss, rapid heartbeat, nervousness, irritability, and heat intolerance. The excess TSH stimulates the thyroid gland to produce more thyroid hormones, disrupting the body's metabolic balance. In contrast, some pituitary tumors do not secrete hormones, but can still cause significant problems by pressing on surrounding structures. These are known as non-functioning pituitary adenomas. As they grow, they can compress the normal pituitary gland in nearby tissues, leading to headaches, vision problems, due to pressure on the optic nerves, and hypopituitarism, which is the reduced secretion of one or more pituitary hormones. This condition can cause various symptoms depending on which hormones are affected, such as fatigue, weakness, decreased libido, and infertility. Pituitary apoplexy is a rare but serious condition that occurs when a pituitary tumor suddenly bleeds or its blood supply is interrupted. This can lead to a sudden onset of severe headache, visual disturbances, and hormonal deficiencies, requiring urgent medical attention. Diagnosis of pituitary tumors typically involves a combination of hormonal evaluations, imaging studies like MRI or CT scans, and sometimes visual field testing if vision problems are present. Understanding the specific type and behavior of the tumor is essential for developing an appropriate management plan. Pituitary tumors can significantly impact the production of multiple hormones, leading to a wide array of symptoms and health issues. Depending on whether the tumor causes hypersecretion or hyposecretion of hormones, it can result in conditions such as prolactinoma, acromegaly, gigantism, Cushing's disease, hyperthyroidism, or hypopituitarism. Accurate diagnosis and understanding of the tumor's effects on hormone production are crucial for effective management and improving the quality of life for affected individuals. 15. Hypopituitarism. Hypopituitarism is a condition characterized by the reduced production of one or more hormones by the pituitary gland, a critical component of the endocrine system, located at the base of the brain. The pituitary gland, often referred to as the master gland, regulates various other glands in the body by secreting hormones that influence growth, metabolism, reproductive processes, and other vital functions. When the pituitary gland fails to produce adequate levels of these hormones, it can lead to a range of health issues, depending on which hormones are deficient. The pituitary gland is divided into two parts: the anterior pituitary and the posterior pituitary, each responsible for producing different hormones. The anterior pituitary secretes hormones such as growth hormone, adrenocorticotropic hormone, thyroid-stimulating hormone, prolactin, luteinizing hormone, and follicle-stimulating hormone. The posterior pituitary releases antidiuretic hormone and oxytocin. Hypopituitarism can affect any or all of these hormones, leading to a condition known as panhypopituitarism, when all anterior pituitary hormones are deficient. One of the most common causes of hypopituitarism is pituitary tumors, which can compress the normal pituitary tissue, impairing its function. Additionally, surgical removal or radiation therapy targeting these tumors can also damage the pituitary gland. Other causes include traumatic brain injuries, infections such as meningitis, autoimmune diseases, and genetic mutations that affect pituitary development or function. In some cases, hypopituitarism may result from diseases affecting the hypothalamus, the brain region that controls the pituitary gland. The symptoms of hypopituitarism vary widely depending on which hormones are deficient. A deficiency in growth hormone in children can lead to growth retardation and short stature, while in adults it can cause fatigue, decreased muscle mass, and poor quality of life. Adrenocorticotropic hormone deficiency results in reduced cortisol production by the adrenal glands, leading to symptoms such as fatigue, weakness, weight loss, low blood pressure, and a reduced ability to handle stress. Thyroid-stimulating hormone deficiency leads to hypothyroidism, characterized by fatigue, weight gain, cold intolerance, dry skin, and constipation due to the thyroid gland producing insufficient thyroid hormones. A lack of luteinizing hormone and follicle-stimulating hormone affects reproductive health, causing issues such as infertility, irregular menstrual cycles in women, and decreased libido and erectile dysfunction in men. Prolactin deficiency can impair lactation in postpartum women. Antidiuretic hormone deficiency causes diabetes insipidus, leading to excessive thirst and urination due to the kidney's inability to retain water. Diagnosing hypopituitarism involves a comprehensive evaluation of the patient's medical history, physical examination, and a series of hormonal tests to measure the levels of pituitary and target gland hormones. Imaging studies such as MRI or CT scans are often used to identify structural abnormalities in the pituitary gland or hypothalamus. Living with hypopituitarism requires careful monitoring and management of hormone levels to prevent complications and maintain overall health. Regular follow-up with healthcare providers is crucial to adjust hormone replacement therapies as needed and to monitor for any new symptoms or changes in existing conditions. In addition to medical management, lifestyle modifications, including a balanced diet, regular exercise, and stress management, play an essential role in improving the quality of life for individuals with hypopituitarism. Understanding the role of hormones and recognizing signs of imbalance is crucial for early diagnosis and effective management of these conditions. Through proper medical care and lifestyle adjustments, we can better address hormonal imbalances and improve the quality of life for those affected. Stay tuned for more insights on health and wellness topics. Don't forget to like, subscribe, and hit the notification bell to stay updated with our latest videos.